Have you ever felt like this? You're about to begin a new rotation and you're excited about starting, but you wonder, how do I do a really good job on this rotation? Like, how do I get good reviews? How do I make a good impression with the attendings? We want to help you with that. We want to help you feel clear about what it is to be excellent on this rotation. We want to help you focus on your success. We have high expectations of you on this rotation, and we believe that you have what it takes to do a great job on this. Think of an urgent care shift like this. Basically, you're on a day-long race to get patients in and through the department as quickly as possible by using your skills and your evidence-based knowledge applied to their needs. All this while trying to build patient rapport on somebody that you'll see once, maybe twice. So let's break that down a little bit. Efficiency is your ability to see and move patients through the department. That involves making decisions, ordering tests. Your proficiency is your ability to apply your skill and your evidence-based knowledge to their needs. And your patient rapport is your ability and your skill to make a connection with a patient in a very short period of time. Let's help you figure out how to do that in this rotation most efficiently. All right, to work on efficiency on this rotation, the very first thing is to pay attention to the track board. This is your clue to know when patients are ready to be signed on, when the orders are completed so that you can move them through the department and ultimately discharge them. It's easy to get distracted from keeping track of this for lots of reasons, but an essential skill of efficiency is paying attention to the track board. Another skill of efficiency is being prepared with a plan. So when you come to present your findings, your differential diagnosis, have it in your mind what you would do if you were alone with this patient. How would you make a decision and what would your next action be? Have a plan when you're presenting to your attendings. Ordering tests in urgent care is an important step in making diagnoses. We want you to have a bias towards action in this. We want you to be thinking about what tests might make a difference in the patient's diagnosis or treatment. And we want you to feel comfortable to be making those decisions even before you staff your patient. If it's uncertain what you really think you should do, then we would encourage you to staff the patient first. But if you're fairly certain that an order or a test will make a difference in the outcome, then you should have a bias towards action and start doing that. There would be an exception with the larger tests, such as a CAT scan. We would definitely want you to discuss that with attendings first. So documentation is another area where you can get bogged down through the day. We want you to find the balance between documenting sufficiently so that you can remember the patient's detail, but not documenting to completion so that you end up not being able to sign up for new patients through the day. There are several tools that will help you in your documentation. One of those is the M-Modal dictation tool. We would encourage you really to use that tool rather than typing. It is a more efficient way to document. We also would encourage you to use your Epic Haiku app to help photograph when there are visible findings such as a rash or a physical exam swelling or injury. That also helps you create a more efficient document. Another efficiency tool is if you happen to notice that the patient that is registering is going to be in need of an interpreter, it would be wise for you to try to get into the room at the same time as the nurse who's doing the triage. This creates a great deal of efficiency using the same interpreter service for the triage as for your own history. Building patient rapport in urgent care can be one of the most challenging skills that you're going to encounter. You have one visit to present yourself, build a connection, engender trust from patients who you haven't a long-standing relationship. There are some ways that you can improve your ability with this. The first thing is, be thoughtful about how you enter into a room. You want to enter the room with the patient's name in mind. Make sure that you enter the room and wash your hands publicly. Greet the patient by name. If there's another member in the room, be sure to address this with a simple question of who is with you today? And make sure that you capitalize on eye contact. It can be very reassuring to a patient to know that they have your entire attention. And it can be very non-reassuring if your attention is distracted towards the computer. As often as you possibly can, try to make eye contact with the patient. Another means that you can build patient rapport is to pay attention to their needs. If they have a need for pain control, perhaps it's a good idea to offer some Tylenol or ibuprofen quickly if that's appropriate to their medical condition. Being proficient in urgent care is really applying your skill and knowledge base to their needs. One way that you can improve your proficiency prior to this rotation is to refresh your mind on some of the physical exams that you'll encounter on this rotation. You will definitely see patients who have low back conditions, and having a physical exam in your mind of that. Looking at your musculoskeletal exams of the knee and the shoulder prior to entering. Also looking at a good neurologic exam and being confident with those exams prior to the rotation will help you with your proficiency. Another skill of proficiency is making that plan before you present to your attending. We really want to emphasize that this is a skill to help you build your knowledge base. We don't require that you be perfect or that you know all the answers prior to presenting the case. We simply want you to have a plan about what you might do if you were alone with this patient, what your next action would be. That may involve looking up some information. That may involve consulting an expert. Whatever that is, have a plan and be ready to present that when you're presenting your case to your provider. Another skill is being available and ready for the nurses if there should be an emergency to come in. They may address a patient out of order with you to ask you to see them because they have a concern that there may be an urgent, pressing need. Be available to them for this. This may be some of your best learning experience. Some common emergencies that might present to our clinic would be an anaphylaxis reaction, a respiratory difficulty or arrest. It might involve a syncopal event or a seizure-like event. Be prepared in your mind to be participant in these events. Of course, there'll be attendings that will be available as well. So excellence in urgent care is not being the most efficient provider in urgent care. It's not being the most knowledgeable and skilled provider in urgent care. It's not the provider who has the best patient rapport. It's really a combination of three of these things, and toggling back and forth between patient rapport and efficiency, between your evidence-based decision-making and your patient rapport. These are the skills of urgent care, that balancing back and forth between these three very important components of this practice. So we want to give you, in summary, a few examples of ways that you can learn from other residents who have missed in their excellence. And these are some things that you can learn from to not repeat. The first thing is not being on time to start seeing patients at the beginning and start of the rotation. That means walking in at 7 o'clock with your coffee or walking in at 2:30 and expecting that you'll have a little transition time before you see a patient. Our shifts and doors open at 7 o'clock in the morning, and we could have an emergency patient show up right at that time or be waiting for us to open. We need to be ready to see patients at 7 o'clock. That means coming to the rotation a bit early so that you can do whatever you need to get yourself ready, get the computers on, that kind of thing. Another mistake that residents have made would be not paying attention to the trackboard. We emphasized this a little bit earlier, but you do not want to be the resident who the attending has to go into the room and say, hey, by the way, there's a patient waiting to be seen. Would you like to see them? That is irritating to an attending. We want you to be involved and paying attention to the trackboard. We don't want patients waiting to be seen. We want, if we're available to see a patient, we want to be signing up for those patients. Another mistake that residents make is not using the tools we have to order tests and labs. We have a specific tool called the Manage Order tab that is designed for the urgent care to provide efficiency in ordering tests. It includes all of the tests that we do out in Onalaska, and it gives the correct ordering information. Oftentimes, if residents are used to typing in lab orders, we will have nurses have to find us and say, Dr. So-and-so, this order wasn't put in just right. Can you change this? That's terribly inefficient for all involved. So get used to ordering off the Manage Order tab. Another mistake that we've seen some residents do is trying to finish promptly at the end of their shift or trying to finish a little bit early. This is not the character that we're looking for in the resident. We're looking to see that when there are patients to be seen, we see patients all the way to the end of our shift, which means 2:30 in the morning shift and 10 o'clock or the last patient that comes in on the evening shifts. We really want to build that character of finishing strong. Another weakness we've seen in some residents is not stretching themselves beyond what their primary area of interest is. This might mean that they back away from doing certain procedures that they may not feel particularly skilled with. It may mean that they don't want to be involved with certain types of diagnoses or treatments. We want you to try to stretch yourself. The point of this rotation is not to know everything about that you're seeing, but to have growth. Growth in that efficiency, growth in your proficiency, and growth in your building of patient rapport. We want this rotation to stretch you, and that demonstrates success when you experience growth in those areas. So that's going to involve you doing things that aren't necessarily always in your sweet spot of what you're going to be doing in the future. We are really excited to have you join us on this rotation, and we're thrilled that you are interested in learning about what we do in urgent care and that you will be caring for the patients that we also are caring for. So welcome aboard.